So why haven't we heard much about PRP for erectile dysfunction? That's the big question. So ED is really common. 52% over 40 dealing with this. And it's actually relative incidence is if you just look at age by decade, that's the percentage. So 40% at 40, 50% at 50, 60% at 60, just the number is not going in the right direction. So definitely affects your self-esteem, reduces your confidence, affects your libido that can progress to anxiety and depression and put a ton of stress and strain on your relationship. It's not good for your quality of life. So traditional ED treatments, it just the effectiveness varies. We don't really know like timing, when is it best to do it, what kind of side effects are we dealing with, do we have to add a little more and a little more because we're gaining a tolerance to the medication used, and it's just a temporary fix. Okay, so they did a PRP study for vascular ED. The slang for the PRP for vascular ED is called the P shot, and it's platelet-rich plasma used. And so they looked at 150 different patients diagnosed with vascular ED. All the participants were kept off the little blue pill for a month, and then they assessed the erectile function. They did it through questionnaires and a dynamic ultrasound looking at the blood flow. So the subjects were given the P shot, and then 1 month post treatment, another round of questionnaire and ultrasounds were conducted. So they saw 80% of the patients subjectively reported a noticeable improvement in their ED symptoms. The ultrasound assessments equally showed improved blood flow. Kind of important. All right, the big deal on this, and this is what's fantastic, is you don't have to guess. So basically, if a blood test means the mean platelet volume, basically it's a simple blood test, the MPV is predictive of how well a patient would respond to a PRP or the P shot. So basically, lower mean platelet volume markers were a strong predictor of treatment success. That's huge. We're not guessing anymore. So what is PRP? So platelet-rich plasma. It's using a small amount of your blood, and they process it down, they spin it down, and then inject the platelet-rich plasma back into the corpus cavernosum. So the P shot promotes the healing and tissue regeneration that's involved there. So it's used a lot with orthopedics, but also hair loss and some other ways. But the growth factors and the proteins within the platelets stimulate the natural healing process. So it seems like a pretty good idea to me. So why haven't we heard about this in mainstream media? Well, you got money for one PRP injection or forever on a little blue pill. So are we trying to fix the problem, or are we just managing patient symptoms for the rest of your life? It looks like it's the latter right now. That's what you're going to hear in the mainstream media. So ED is just one piece of that puzzle. We have to look at the whole thing, and why is that in the first place? And so, yeah, even doing a P shot, that definitely helps heal the process, but how did it happen in the first place? So, it would be good to just take a little bit deeper look and just kind of try to put all the pieces of the puzzle together. So at Attain Health Omaha, we're here to just provide some of those additional options that you wouldn't normally hear about, and we will be your guide as far as decades worth of hormone experience on all sides of our medical staff. So we'll put all those pieces together, work with you to have a successful outcome. So if you're interested in looking into a little more of this, give us a call, 402-505-3210.